All right, hello everybody. My name is Dr. Nguyen Tran. I'm a chiropractor, acupuncturist, physical rehab specialist. And today we're going to talk about the spine once again, but today we're talking about the spine of children. Because over the years, people ask me, should children get chiropractic adjustments and why, and when should they get treatment? Well, first of all, let's go back to adult and children. We actually are the same. It's a smaller version of us, right? Children is just a smaller version of adult. And before the age of 25, many of our children are still growing, so a lot of the joint and the bone are not solid. Some of them are more collagenous, so they're more flexible. But that is more reason why we should start children on chiropractic treatment and posture analysis much younger. How young? As soon as they start school. Why? Because most children, when they're home, they run around, they move around, no big deal. But this hour in school sitting on those desks is actually not very healthy for our children. Because, when you start in the desk, you start sitting like this, and that's where we start slouching. And then the chair is not the best for us either, because without a chair, we tend to sit on the floor. We have to get to the floor, we have to get low. But with the chair, we only get down to about here. And have you wondered why many children have short, tight hamstring? Because they never go below the chair. So as soon as they're school, sitting, hour and hour in the school is poorly adjusted for the spine. Children are supposed to be active. They're meant to be out there playing, running, climbing, and that's how beneficial to their growth as well as their dexterity, and they improve on their, eye, hand, foot coordination. But sadly nowadays, we don't have a lot of time for activity. I mean, most school kids maybe have 20 minutes a day outside. So that's why a lot more kids have back pain and neck pain. And sometimes they don't know how to explain it. They don't know how to tell you that they have back and neck pain. And then the other thing is scoliosis. I think many of you might have heard the term scoliosis, and I see it more frequent now. But a lot of time it go undiagnosed. Then because, back in the day when they screen all the children, they're supposed to check the spine to make sure there's no curve. But just in the past years, I have quite a few young teenagers in their 14, 15, and finally realized that their spine is crooked. They should have been diagnosed earlier, but nobody noticed, nobody examined it. Chiropractic is amazing for children because their spine is still very clean. It's not like adult when we sit and we injure our spine from car accident, from sport injury, from many injuries. So there's so many little traumatic for many years build up, so our response are a lot slower. And it's very safe for children to get chiropractic adjustment. If you don't believe me, just bring them to any of them to a chiropractor. They respond really well because, like I said, they don't have a lot of trauma. And also, the sooner we educate them on the importance of spine and posture, the better, the healthier they are for them. Especially now with the iPad, iPhone, computer. And most children, you don't see they use the desk at home anymore. They either lay on the couch, or sitting playing game, or slouch over a corner with iPad. So the posture is not very good. At school, nobody tells them to sit up straight, But they have to understand the reason why you need to take care of your posture. Because especially when they go through puberty, if they have poor posture, then the deformation of the structure is harder to fix, and it can lead to many other joint problem. And then we have poor posture, we have poor spine. It can lead to heart issues, lung problem, not just structural issues. So young children and young people are definitely important for them to get help with the spine checkup. So at least, you bring them to any doctor or chiropractor to do posture analysis, look at the posture and see if they have, elevated shoulder, the spine's crooked. And then the other thing I noticed quite a bit, because quite a few of my child are in sport. More often than not, they get sport injury, but it's minor. So they usually just ignore it, or they don't tell anyone about it. And then as they go older, that injury became a huge problem later in life. Remember, any injury you sustain to your body, especially your ankle or your knee or your hip, anywhere in your spine, it never disappears. They just hide it somewhere and then eventually come around and, 10, 20 years later and show you that, oh, hey, I was hurting 20 years ago, but you ignore me, so now it became arthritic. Several of my patients who have spinal disc degenerations, bone spur in the spine, now it's because of some injury they sustained many, many years ago. And they didn't know it was that big of a deal. Let's say a football injury in the neck, flip over bicycle, rollerblade and fell and hit on the knee. Although injury, the sooner you address them, take care of them, the better they are. So make sure if you're trying in any kind of sport, make sure they see a chiropractor, physical therapist, whoever, anyone that have ability to examine them, guide them to make sure that they don't work through the pain. They don't have any existing hidden conditions. So yeah, the better the spine, the healthier the spine, the better communication between your brain and the rest of your body, the more effective they are in sport and even school performance. But when you have poor posture, it puts tremendous amount of pressure on the circulation. So the brain doesn't get as much oxygen that they're supposed to get. So sometimes that's what causes children to be sleepy and unable to pay attention. So if they have good spine, they have healthy spine, they have good posture, they have good circulation, the mind works much easier. And I think the other thing that we don't think about is children nowadays carry backpack. And I have my youngest, 12 years old, she's turning 13, and her backpack is so heavy. I mean, I put it on and she walked like this, every day, and it definitely affects their back, their hip, their spine. And then sometimes they get lazy, they just put it on one side and then they walk around like that. So I think our children suffer a lot of ache and pain that we don't think about because they get so used to it. Remember, you do something long enough, you get used to it, you learn to live with it. That doesn't mean it's good. And that's, I think, the cause of major chronic disease later on in life. Because if you know it's bad, you wouldn't do it. But because it's gradually changed, that's gradually affecting you that you don't detect is imminent danger. That's why you keep doing it. And then enough down the road, 10, 15 years down the road, that's where you have back and neck pain. Backpack is a huge problem right now because it's so heavy. Children need a lot more attention from adults to make sure that they have good posture, they don't suffer from overused backpacks, too heavy backpack, and then electronic, computer, phone, iPad. But it's much easier to come from a professional than from our own parents. So if you need help, let us know. We'll take some pictures of the posture of them and show them, educate them. Sometimes we treat them like a small child and we just yell at them instead of explaining to them why it's so important and the consequences. Yes, they're so young, they don't care much, but at least if we start them now, as they get older, they be more aware when they get hurt or important of, why they need to do what we ask them to do rather than say, hey, do this, and no explanation come attached. All right, so hopefully this information will help. Let me know in the comment below if you have any more further questions.